Premier Doug Ford says he is looking at further privatizing some healthcare services, but insists OHIP will cover the costs. Oh, and he swallowed a bee during his news conference. I'll show you what the buzz is about later, forgive the pun. But first, to the much more serious matter of the future of Ontario's healthcare.
Guys, we can't continue doing the same thing and pouring billions, which we'll continue doing, and expecting a different result. Something has to give, so we're going to get the best ideas from the professionals, and we're going to implement those ideas.
Some of Ontario's healthcare system is already privatized, like labs, GPs, or some walk-in clinics. Further privatization has been a hot topic at Queen's Park this week after the health minister sparked a controversy by confirming the government was considering it as a way to ease the strain on hospitals.
Are we looking at options? Absolutely.
The Premier didn't give any specifics, but did confirm setting up private clinics like the Shouldice Hernia Hospital is a possibility.
If there's a way of delivering better, publicly funded health care, we're going to do it.
The NDP issued a statement shortly after warning privatization will cost patients. They bill you for your room, the painkillers you take, your meals, the physical therapy you need, and more. People walk away from these facilities with bills for thousands of dollars. But Doug Ford insisted that won't happen.
There's one thing we'll guarantee. You'll always be covered by OHIP, not the credit card.
During the long weekend at the end of July, 20 hospitals had to close ERs due to lack of staff. Last weekend, 6 were temporarily shut. One of the reasons hospitals are strained has existed long before COVID. Patients who are ready to be discharged but still need care have nowhere to go. According to the Ontario Hospital Association, there are approximately 21,000 acute care beds in Ontario. The Ford government confirmed to CityNews roughly 5,000 people, or 24% in those beds, are waiting to be discharged to another location like long-term care. That creates a backlog in hospitals, a fact the Premier acknowledged the problem to CityNews today.
We're going to make some changes there.
Now that issue, though, is a big contributor to hallway medicine, which Doug Ford promised to end during his election campaign in 2018. So, I mentioned earlier that the Premier had an encounter with a bee today during his news conference. It's been creating quite a buzz. Here's the moment and how he handled it.
It's coming from the health sector. Holy Christ. I just swallowed a bee. I'm good. He's down here buzzing around right now. He has a lot of real estate. Now, if that wasn't the clip, okay, this is going to be replayed over and over again. This is a classic, okay? This is, holy Christ. Sorry. Oh, this is a good one. I'm going to be howling tonight watching this tape.
It was pretty funny. Fortunately, he was okay. That is possibly the very first time a politician has swallowed a bee live on air, and the Premier did say he was all right.